St. Clair County has been known for working together and taking a collaborative approach to addressing community needs for many years. The Community Services Coordinating Body, or the CSCB, is a perfect example of this approach. And what an accomplishment to be reflecting on 40 years of sustained collaboration. 4 decades of working together to build this strong, more connected community is a testament to the shared commitment and the vision of everyone involved to achieve a lasting impact. The CSCB highlights the dedication, the mutual respect, and shared vision that have guided this group since its inception. To highlight the achievements and people involved, we put this video together to celebrate the 40th anniversary.
I don't think a lot of people realize that back in the 80s there was a committee in the House of Representatives here in Lansing, and Joe Young, who was representative then, chaired it on prevention of mental disabilities. Well, that committee came up with the whole report. In there was a recommendation that in order to really prevent some things, to really deal with some community issues, that you needed a group that's going to bring together across systems. And that spawned a discussion between Roger Ficcioni and Betty Tableman, who was the head of prevention at the Department of Mental Health, as it was called then, about that this coordinating body could be a model because it's bringing together people cross-sector from the community in doing planning and implementation. By 1986, the department was funding some folks to be staffed to local coordinating bodies and pulled together, and was really replicating what was happening in St. Clair County.
I came to St. Clair County just as a CSCB was first being founded. It was a pilot program to see if we all could work together. And I came in that was fall of 1984, and the major agencies such as Community Mental Health, Department of Social Services, MESC, which was the Michigan Employment Security Commission, United Way, and so on, formed a group, applied for a grant from the state of Michigan, received the grant, and that was the beginning of the Community Service Coordinating Body.
The group coming together was executive level from a number of agencies.
That group of people became very committed to identifying areas of service that we needed to address.
I think the early years of the Human Services Coordinating Body was explaining why it was of value. And again, the investment was not just money in the beginning, it was more time that you could sit down and talk to each other. But the more that happened, the more that we began to become aware of what each other was able to bring to the table.
Needless to say, when that grant ended, it didn't seem to be much question among the membership about continuing to meet and determine different issues that they should be addressing.
It allows us to all kind of speak with a common voice to better our community.
It's nice to have us all at one table so that we can collaborate on issues to see what the common resolve would be.
Because we come from different areas, we can see the needs maybe that others don't, and then come together and work on ways to solve those.
My very first recollection of really relying on the CSCB for collaborating help was when we were looking at the issue of homeless youth. We ended up buying a home for homeless teenagers in St. Clair County, but I remember having invaluable insight and perspective from members of the CSCB.
Whether it was farm families back in the 90s who were experiencing corporate farms and losing their ability to make a living off their own small farms, we brought together Cooperative Extension, Michigan State Cooperative Extension. There were mental health issues there, there were social services issues there were domestic violence issues there in many cases, there were law enforcement issues, and came together and came up with a comprehensive response to that particular issue.
The CSCB has given us a platform, I think, for more engagement from community members to add their input in on how we're going to improve the health of the community.
It helped us learn that this was a positive way of doing business, and actually it felt pretty good.
A number of the things that you see out there in St. Clair County today came out of that recognition that we needed to do something. The current CAN Council was born out of people coming together and saying, you know, what are we doing about child abuse and neglect? And I created a center called the McKinnon Center, and now it's an independent organization. The Center for Independent Living never existed or hadn't existed. it became created and now is an independent organization out there. So the examples are numerous, and I think people who are newer to the community just maybe assume that, well, they must have always been there. But they were there because people came together and made them happen.
The Housing and Support Services Work Group came into being about a little over 20 years ago, and it was a small group at first of nonprofit organizations that believed in the mission of ensuring that people had some place to live.
Most recently, the CSCB has helped us explore more how our region would respond to any kind of natural disaster or man-made disaster.
During COVID, there were many issues surrounding our community. Working with the CSCB allowed us all to kind of work together and push solutions for the greater good.
10 years ago, maybe that wasn't something a CSCB would have gotten into, but now because they continue to be a leader in trying to understanding how we move this community forward, it's something they're willing to tackle.
Really, what caught my fancy and my attention was creating a list, a master list of all the social agencies in the community. It was right in my right drawer of my desk, and I popped that out at least once or twice a week when people would call in, they needed help, and the CSCB was very instrumental in getting that happening.
There was a situation last year where there was not an identified homeless shelter for males.
Because of COVID and other situations, the rescue mission didn't operate for a couple of years.
So it was a committee from CSCB that addressed that situation and made it happen.
Which bridged the gap until the men's shelter was able to open again.
The back to school event, where we for over 20 years now have distributed new backpacks full of school supplies to kids in the community. We have been helping kids get ready for school. That's one of my favorites. That's one of the fun events that the community has every year.
One of the initiatives was the community car seat program. That was funded through the Office of Highway Safety and Planning, and we were all trained in how to properly install car seats for children. And that was kind of a new initiative. That was when car seats were first being required by law. It would bring the children, we would properly put the kids in the car seats that were fit for them, show the parents how to properly install those in the car, and then how to change them as the child grew. We gave out hundreds and hundreds of car seats. But I think what's really cool about that is that we have data that shows that in St. Clair County, there has not been a child who has died as a result of a car crash that has been safely secured and properly secured in car seats.
We went from having a few free preschools across the county to now having free preschool, working towards free pre-K for all. And the CSCB has been able to help us secure stronger partnerships. They've been able to really just get behind us in finding the families and educating families on what's available. And it takes everybody around that table to be able to do that.
The Adolescent Services Work Group is primarily for youth that are from 8 to 18 years old. That part of life that was not really being served through the CSCB. We have created a directory of services. We've created a Speakers Bureau guide, but then we have also created a gap survey. We wanted to hear from the youth. This was a survey specifically for youth, and over the course of a year, we collected a lot of data, and that data helped us understand how we can help and assist also the CHIP, and where the county is looking at improving different services or things that we need to do for our youth. But then we also knew that us adults are in a room trying to serve youth, and we didn't have a youth voice. We worked with the Virtual Learning Academy, VLA, and their youth came and spoke to our work group. It was amazing because these youth had a voice and they spoke to us and told us the things that they needed.
The sobriety court that district court has, there was conversations about, boy, we could use another problem-solving court. We need a sobriety court, or we need a drug treatment court that doesn't focus on folks that maybe have dual diagnosis or just a mental health diagnosis. And so that conversation was very much pursued and talked about at CSCB.
We recognize the need from the Executive Opioid Oversight Committee to really have groups that were actually looking at the services that were available in the community, and also to kind of do an assessment of what else was needed to address this problem. So 2 subcommittees were formed. One was related to education and prevention, and the other one was what treatment services are available in the community. Eventually, those 2 go together and be one big work group, because really you kind of need to look at all those things together: prevention, treatment, recovery services for addictions. And that group has really done a lot of great things.
There are so many things that we've been able to do because of our structure and our commitment and our passion and our mission to ensure that we connect with each other and that we collaborate.
We received funding through the Office of Highway Safety and Planning, and what we did was we targeted underage drinking because we knew that that was an issue in our community. So we took the unique approach of working with each one of the high schools in our community and pulled them together, and we created an actual video that we called "It Would Never Happen to Me." The unique thing about that video was we had so many key partnerships that came together to rally around, from Marysville Police and Fire to the funeral homes to the criminal justice system and the jail and Judge Platzer. It was just a really unique video that then we distributed them throughout the community, through the schools, through the different substance use programs. I mean, it was a very cool project that we did back in the early 20s.
Our first community resource fair was at the Salvation Army, and it worked well. That's when we had over 900 people come. Thank goodness for SC4, because we've had it there every year since then. We have a lot of people. We have a lot of vendors, nonprofits, agencies coming in that day. We had 73. That has grown significantly since our first community resource fair.
We obtained a planning grant for senior services for the entire community. Having this beautiful facility for end-of-life care, the hospice home, was really driven a little bit by the CSCB and what they found on different surveys that they conducted throughout the community.
Obviously, COVID was huge, right? It was 20 months of kind of digging in the dirt, taking care of people, taking care of the communities, working with all of those folks that are also members of the CSCB. I think was one of the greatest achievements in my career here.
A few years ago, there was kind of a shift to trying to get more community partners to help cover the cost of it. CMH had shouldered the burden for a long time, and so they did that. They went out and they got contributions based on the size of the agency and who the agency was and those kind of things.
And since then, that has just, I think, expanded exponentially. I want to say under the leadership of Deb Johnson over the last probably 8 years, we have encouraged non-human services organizations to join our group, such as the Sheriff's Department, the City of Port Huron, the Community Foundation. And that really turns what we do at the CSCB level into a full community participation.
We did surveys, we asked people what they thought were the top problems in the community, we looked at all those things, and we ended up with 3 strategic priorities. The first one was economic self-sustainability. It's having opportunities for people to be able to earn income, to live a decent quality of life. They have the resources to do that. The next one was education. By increasing the opportunities for education for people throughout their lifetime, it helps people feel useful, needed. A lot of people do volunteerism later on in life, so all those things are important for an overall healthy community. The final strategic priority currently is health and wellness, because we know that physical exercise does help promote, I would say, healthy minds and healthy bodies. And moving forward, the CSCB will continue to use that framework to update their strategic priorities. There's still a lot to be done, and I think through the CSCB and working collaboratively together, we are going to make sure that we are going to be able to address those needs for years to come.
It's a valuable activity for professionals to be involved in, and it means a lot to the clients. I know that the thousands of seniors that we served every year, without the support of the agencies in the CSCB, we wouldn't have continued.
One of the most significant achievements is that you're still here after 40 years.
Because there are not that many left in the state anymore. The ability to have expanded its membership, to keep everybody focused and interested in helping each other, I think has really made the difference in terms of keeping it alive and vibrant and dealing with current issues.
It has been so inspirational to see people buying into our community health improvement plan. Everybody's engaged in just having our community be well and healthy.
In my working with Operation Transformation, I have worked in 11 different counties. I was able to attend some of these meetings in other counties, and this one operates at a level that's far greater than any of the 11 counties that I've been in.
What I think's been really memorable is really being welcomed into the community. Like I said, when I first started, I was a new professional. I can remember my first meeting was a table of executives, directors, people that I considered important or prominent in our community, and I remember sitting there going, and who invited me to the table? But that was my internal feeling. It wasn't the feeling I got from others there. So seeing that open invitation to come join and be part of something bigger than self is really memorable.
We collectively created a culture within our organizations that being involved in the community was something that you should do.
When I first started attending the meetings myself, when I took over as sheriff, the idea that dozens of people enter a room with all different expertise, but the fact that we all came together, it was really impressive to see everybody in that room with a united goal, and that was to be effective in providing service to better our community.
You sit there and you begin to realize, you know what, this is working, and people are talking, people are helping one another. There are agencies that do care what the other agency is doing. That particular day, I remember going back to the office and just thinking, boy, if more of this could be done within this community, just think of the many challenges that we could overcome.
Certainly a message I would want to share with current members is continue doing what you're doing, and that your work is important. The work we all do is very important, and sometimes we don't necessarily always see the outcomes of it, but what they do is exceptionally important.
I think the message I would like to share with the current members of the CSCB is thank each and every one of you for your contributions to the betterment of our communities, and I appreciate all of the friendships and partnerships to meet all of our goals, including the Emergency Operations Center's goals.
You're better working together than you are alone.
Consider your time with the coordinating body as an investment. Maybe you don't see a return every day, all day, but you will see returns on your investment. At the end of the day, it's all about relationships.
Don't be afraid to ask for help. So I would strongly encourage people to continue to access the talent that's across all the different members.
What we do matters, and it only happens when we are all around the table, all working collaboratively, and we have those strong partnerships to make it happen.
I would hope that it'll be there 20 years from now and 40 years from now, because it's the best opportunity that we have to stay working together in this community, and all of our clients in every discipline benefit from it.
Look at all the things that we've accomplished over the last 40 years. To be collaborating successfully for 40 years is truly an extraordinary achievement. It highlights the dedication, the mutual respect, and shared vision for St. Clair County. The collaborative work of our members is irreplaceable. I am so honored to have been a part of this initiative for more than half of its existence, and having led it for the last 13 years has truly been a privilege. I am so excited to see what the future holds for the CSCB of St. Clair County.